But you don't listen to them. If you can make me look better, then yes.
It's on. Dr. Allen, thanks for letting us have a chat with you.
It's exciting to finally get this going.
Yes, long time coming. Why don't we start with your high school football days? Let's start with
I
your
don't
best
remember.
memory.
I don't
Yeah,
remember.
right.
I had too many hits to the head. I don't remember.
Let's discuss why I've heard many people around town dub you as the greatest athlete to leave Mountain View.
Well, that can't be true. I did love to play football. Played with some amazing athletes. I was very fortunate to play with Jesse Parker as the coach.
It'd be fun to have a
Played
podcast
both
guest.
ways. Very tough man and held us to a high standard. Yeah, it was good time.
Do you think you learned some of your work ethic from your football days?
That and my father, who had me as a young man work all the time in our backyard and grew up, the smell of cut grass is just, it's beautiful to me.
I was going to ask what type of work, but it sounds like you're doing yard work.
Some yard work,
yeah.
and then we moved and actually we picked oranges, a lot of oranges.
Interesting.
Had some orange trees, so love to work hard.
Very cool.
Yeah.
When you were growing up, high school, did you ever imagine you would be a doctor? When did the dream to become a physician start, I should say?
Actually, it did. When I was young, we were in our yard, and back in those days, neighborhood hide and seek was very popular. Every kid in the neighborhood would be playing, and I'll never forget a time one of the kids was on top of a fence, running as fast as they could to get away from being tagged, and they tripped and fell off the fence onto the spikes of the gate, and it landed in the thigh, and we were all traumatized, and we remember carrying him, like, let's go ask my dad, who was a physician, and I got to put on gloves for the first time, and I got to pull the paint chips out of inside their wound, and from that moment I was like, I want to do this. This was a game changer for me.
How cool? How old were you?
I don't know, 13 or
How
14.
cool is that?
And it was just, I like watching my dad put it all back together, and when it was done, it looked so perfect, and they were, able to help them with their pain because they were in excruciating pain, and then to get them out of the pain, and then to watch it just work as magic. And yeah, I was, never forget that. Always wanted help in medicine and be able to help people like that.
That's amazing. So you go to high school, you go to college, and you start kind of having your sights set on medical school. And what year did you finish medical school?
I graduated in 2003.
Okay. So you did some of it in Central America and then finished up in New York, correct?
So actually I did my medical school in Mexico.
In Mexico. Okay.
I went to the Universidad Autónoma de Guadalajara. Was there for 4 years and absolutely loved it. It was very hands-on. First semester medical student, I delivered 3 babies. Was also suturing, and because they needed all the help they could, and so had a wonderful experience. And then did a year of Fifth Pathway in New York. I was in Yonkers, spent a year there, and learned so much about how the American system worked. And then I did my 3 years of residency in Des Moines, Iowa, at Broadlawns Medical Center, which was a county hospital. And I loved that because it was hard. It was hard work, and it was a county hospital for all of Iowa. So any patient that didn't have insurance and didn't care about themselves, they came to the county hospital, and we got to see all sorts of diseases and infirmities and illnesses and shootings and just trauma, and it was amazing. And so spent 3 years in Iowa.
Amazing. And so you then decided to specialize in family medicine.
Uh-huh.
And you practiced family medicine for how long?
So, well, I've been in family medicine. I graduated from my residency in 2007 till now. So, but 3 years of family medicine training. So since 24, so it's been 21 years.
Amazing.
Yeah.
And in your time in family medicine, what are some of the things that you've noticed about the practice of medicine and that have maybe surprised you? maybe something you didn't expect to learn or expect to have to deal with as a physician?
Oh, that's a great question. There's a lot of things you didn't realize that you'd have to deal with. I would say one of the hardest things that I had to understand is how to bill and how to submit your bills to insurance, and how much time and energy and effort that does to divert your care from the person or the patient, and you spend dealing with all the complexities of how to bill just the right claim just so that you would get reimbursed from your insurance. And it's 100% of that effort is to distract you from taking care of people. And that's not what I got into it for. I wanted to help people and to help people feel better. And I felt like I'm completely distracted and unable to focus on the person because you're so worried about getting everything right and checking every box on your electronic medical record that
Otherwise, you don't eat.
or I don't get paid.
Don't get paid.
Yeah. And even if you do it right, they can still choose not to reimburse you.
That has to be frustrating. The administrative side you didn't expect to have to also get great at.
Yeah.
Now, what was a surprising thing in the positive that, as a family practitioner, that you love? And I think I know the answer to it. You kind of alluded to it, but what's your favorite part of being a family?
Well, the most exciting thing was when I learned about the hormones, and it was, I got to be honest, it was selfish. I wasn't feeling very healthy, and I was following all the medical guidelines, medical standards. I remember in my residency when a patient told me, "I'll lose weight when you do, Dr. Allen." And I was following the guidelines. I was following heart protocol. I was doing everything to help me lose weight, and nothing I did would help me lose weight. And having already gone bald at a young age, and then gaining weight, it was like I'm going down a bad pathway. And so when I finally was taught and learned about hormones, it was just, to me, revolutionary, because you can fix some of these health conditions that I personally was suffering with, and to give me hope again. And it was a game changer for me.
And what year did you discover hormone therapy? Do you remember what year that was?
I think my first introduction was 2008. And then that's when I started to discover it for myself, learn about things. And then 2009 is where I started feeling so much better that my wife was like, "Please help me. I want to feel better. My hormones are out of balance." And then my office manager was like, "Well, help me. Come on, help me feel better." And then it just, one patient at a time, and we started feeling more comfortable. And I'm just thankful to my mentor, Neil Rousier, who has been an inspiration, a light to kind of teach me what I was doing wrong, and then how to help people really feel better.
You mentioned Neil, and that was 2008 when you met him. And how did that come about? What did you go to a conference? Did you train with him in person? What did that look like?
Yeah, no, I went to a conference. Most of his conferences that we went to were in Salt Lake, but this one was, I think, back in Atlanta, Georgia, or it was back east. I've been to so many now, I don't remember, but it was back east, and I remember flying there and being like, I hope this is worth my time. My father had gone to one of his conferences, and a few other physicians, so they had highly recommended it. And man, within the first hour or so, you just learn so much about what we're doing wrong in medicine and why we're doing it wrong. And even though the research supports it 100%, we're still doing it wrong. And it was just so enlightening for me, so fulfilling to realize that there was hope again, and to give me hope, which, I feel as a medical provider, if I don't have hope for somebody, that's hard to give them excitement. And once I had hope, and then once I started feeling better, and then I saw my wife feeling better, it was like, what? We can help people. This is awesome. It was, and then, to give all my patients hope again was just what I dreamed of, that when they come in and they've got a list of symptoms, they've seen all these other doctors and they told them you're normal, but then to find out, hey, you're not normal, let's show you why. It was awesome.
When you say you found out a couple things you were doing as a physician were incorrect or wrong as you learned at these conferences or as you started learning about hormone therapy, do you remember what a couple of the biggest eye-opening moments were, the things that you just remember hitting you like a ton of bricks?
Well, the first one that I remember was thyroid. And, we know thyroid, everybody knows about thyroid. They've
What
heard
is
about.
the thyroid?
Good question. So your thyroid is a gland in your neck, and it's responsible for making some of the most important hormones that our body makes. Thyroid has been found to be involved with almost every cell in your body, can control hundreds of functions, and a hormone is just a key that turns on a cellular function. And first of all, we learned that most of us check the wrong thyroid test, which means the TSH, or the thyroid stimulating hormone, is what we were taught in school to check. And that doesn't really help you feel better. And to learn that, you got to find the T3. And that was just like, I had never even heard of that. And all through my medical, and I trained with some amazing endocrinologists and some amazing professors, and I loved my training, but I realized over time that they weren't teaching me the details of actually helping people feel better. And I think they were taught the same way I was, which is that's not in our standard training. And so what was amazing is to learn afterwards that there's a way to really dig in and find out how people are feeling. And so thyroid was one of the biggest things I learned about.
So Doc, when someone's ready and they've come to their wits' end and they're like, I'm ready to try hormone therapy, what's the path for a patient to begin getting treated by you?
It's actually so much easier than everybody thinks. It's easy. They can do it anywhere, any state. In fact, I just talked to somebody from the state of Washington. We were able to talk on the phone, but it all starts with a blood test. It's so important to do a morning blood test. Ideally, 10 o'clock or earlier in the morning, because we want through the night is when some of our hormones are produced. And so if we can get them to get their blood work done in the morning, when I say fasting, we just like to check without food in their system, but we want them to be drinking lots of fluids prior to. Even black coffee is okay, straight. So they can have all the water, in fact, lots of water. And so just a morning blood test. And from that, there's a very specific tests that we like to get. And once we get that and fill out some just patient paperwork to kind of get to know their medical history. For example, if they've had thyroid cancer or ovarian or breast cancer, we need to know some information on what they've been treated with. But more than that, we want to know their personal history. If it's a female that's had chronic fatigue or fibromyalgia or any other disease where they feel tired and sluggish and worn out and have no energy and they don't feel good, we need to know that so we can then maybe order more specific testing. If they have an autoimmune disease, we want to know. So we just want to get to know them better. And that's through some paperwork. Very easy to do. Most of it can be done online. The other thing is once we get the blood test, then we have all the information we need.
Why a blood test? Why can't I just come in and talk to you and tell you, hey, I'm feeling fatigue and I'm feeling like I'm gaining weight? Why can't I just give you a couple details of my life? Why do you need my blood work?
Well, the truth is I probably don't need the blood test because I've been doing this so long, and a lot of times patients will say, hey, do I need more blood work? I'm like, no, just tell me what you're feeling and we can help you with that. But the most important thing is to get a baseline reading. We want to know where they start. We want to know how low they are. And the biggest problem is most people, when they get their blood work, their blood work always comes back normal. And the reason that happens is because the biggest thing we found is the range which each test is measured by has gone bigger or wider. And so the way that these ranges are set up, more and more people are in the normal range, and yet they're not normal. So we like to go through that with them, because by the time somebody finally comes and sees me, they've seen many other doctors, usually many, and they've been told they're normal, and yet they're coming in saying, this is my last chance, help me feel better. And so by taking some of their old blood work with the new, we can say, hey, you were just missed all these years and we can help you feel better. It's exciting. I can't tell you how many patients are with hope because they like, I'm not crazy. I've been told it's just all up in my head. And when we show that, no, they really feel exhausted, it's very exciting for them because they're not alone and they're not broken.
So your blood work just tells you a story, and
Exactly.
it helps you come up with a treatment that's catered to the individual.
Exactly. It's how we come up with an individualized plan, because not everybody has every hormone broken.
That was going to be my question. So
Yeah.
my mom comes in and I come in. Are we going to be on the same plan? What does that look like?
Depends. You could, but usually everybody's different. Like even if I have two sisters or two brothers, one might have one of the hormones broken, and one might have the other, and they both feel great with their individual plan. And so it's very important to get the testing so we can have a baseline. I guess we were asking also with blood testing, there are other testing. You can do hair sample testing. You can do saliva testing. Years ago, we used to use that, but after testing so many people, blood is just the most accurate. The other testing I can go into maybe in another podcast about the details of that, but it's not as accurate once they've started treatment.
What are some of the signs or symptoms of, let's start with a middle-aged female that she may be having that would lead her to needing to consider this as an option for her happiness in her life?
So can you be more specific with middle age?
Let's say it's
Because now that I'm getting older,
yeah.
middle age
Middle
is
age
changing
is
for me.
in the eye. Okay, here we go. We have a 45-year-old female who's had 4 kids. Youngest kid is 5 years old and she's done having children. Let's give that for an example. What are some of the common signs or symptoms that this individual patient may be having that might lead you or lead her to believe this could be a good option for her?
Great. Okay, so we have 45-year-old. Most likely, if she's had several kids, she's exhausted. She wakes up tired. She's tired throughout the day. She's most likely having to self-medicate with caffeine or a stimulant or something to get through her day because her fatigue is extensive. Most likely, she's having changes in her cycle, which means they're either irregular, they're longer, they're heavier. The pain is worse. The flow is changing, so how heavy it is that she's menstruating. The other thing is her mood's not the same. She'll come in and say, I'm not as patient with my kids anymore. Husband, I don't care about him. And yet they love them, but they're like, sometimes I just can't stop myself. And then their body's starting to ache and things are starting to wear and tear faster. And so what we're finding is that a hormone is just a key that turns on function. And with each child, you start to make less and less of some of the hormones. And so it's a gradual process. They just say, hey, I'm old or I don't recover. And yet it has nothing to do with that. It's just that they don't make those keys anymore.
Gotcha. So let's go with the case for a 55-year-old male now who's now they're getting really old.
Yeah, really. That's me now. So guys are interesting. Going back to women tend to withdraw because they won't want to see their friends. They'll withdraw more as they get older, where men will be like, I don't feel good. And so the midlife crisis of an aging man is his manifestation of his hormone dysfunction. He'll try to go do crazier things to feel strong again or to feel some excitement. They might look for more sexual partners, or they'll literally try to go out more because they don't feel good inside. And so my experience is almost all midlife crises have been hormonal dysfunctions. And once a guy gets his hormones adjusted, tweaked, he doesn't need to seek thrilling, exciting, crazy things. He doesn't need to go buy new cars. that makes him feel better. Once he feels great, he goes back, he feels amazing. For me, I was just so short on my temper. And it's because I was tired. I was exhausted. I'd get home from a long day of work and my wife would ask me to help, and I'm like, no, you know how tired I am? And then my kids would want to play or do something. I'm like, I don't have any energy. Any noise would bother me. And now when your hormones are fine, you feel better. So most men, it's the midlife crisis is a problem with their hormones.
Are there any risks or downsides to hormone therapy?
Yes, there's a huge risk of feeling amazing, and it's really dangerous. We have an 80-year-old that started a new business because she didn't know what to do with all her energy. So no, I'm joking. Yeah, I mean,
Man,
if you look at the research, they talk about a risk of cancer, and that's probably the most common risk that patients come and ask me for or about. And what happens is they don't realize that the biggest research study done on hormone therapy was called the World Health Initiative, WHI, and it studied Premarin, which is made from pregnant horse urine. And that's how they came up with this medicine. And this medicine had the increased risk of causing breast cancer and clots and some of these other risks. And so when patients come in, they ask, well, if we give a medicine, we don't give that medicine. What we like to give is something called a bioidentical hormone. And that hormone is natural. It's what our body naturally makes. And so it's like a key that turns on a car. If you have the right key, it opens up and starts a car perfectly. When you're dealing with a synthetic hormone, that key is changed. It will work, but you got to do a little extra work to make it fit in the right pathway and to work. And so by giving what your natural body or what God gives you, and you restore that to its normal level, the cells function awesome and the body feels restored and healthy again.
That was going to be my next question, is the difference between, what is the difference between bioidentical and synthetic hormones? But you kind of explained that already. Do you feel like in your almost 20 years of practicing hormone therapy, what have been some of the bigger advances or changes that you've seen in that time in this type of medicine?
It's a good question. I remember when we first started, one of the things that we used for testosterone was a troche, it's kind of like a Jolly Rancher. You just put it in your mouth and you kind of, just suck on it or let it dissolve over time. And it was a new, exciting delivery system for testosterone. But over time, we saw that it affected the gums and kind of eroded away. We've gone from creams, injections, pills, capsules, and I've kind of been here long enough, to see that it's gone into now the exciting, new, healthy delivery system is a pellet for that. And so, yeah, I've kind of watched a whole big change over the years.
Explain to us what a pellet is.
A pellet is a specifically type of medicine for either testosterone or estrogen, and it's compounded in a special way that it will dissolve slowly in your fat tissue. And so it's a surgical, very small surgical procedure. It just takes a few minutes. They make a small incision, so small you don't even need a stitch. And then you just slide it right into the subcutaneous fat. And then what's really exciting about that is that a pellet is dissolved by your cardiac output. So as your heart is pumping, it will slowly go through the fat, pull it out, and release into your body. So if you're at a calm, relaxed state, you don't pull very much out. You go work out, you go exercise, get your heart pumping, you'll literally feel, patients will tell me all the time, they'll feel a rush because they'll draw more of that medicine and they'll feel better in that workout. And so it's got a very specific time release over a period of 3 to 6 months.
That's amazing.
It really is amazing. Now, I will tell you that in my experience, it tends to work better in women than men. And the reason that is not that it does not work in men, it's just For women, the pellets are so much smaller and easier to place, and the downtime is so much less.
And they don't need as much.
Yeah, they
Okay.
need 3 days off. Where a male pellet requires so much more. The pellets are so much bigger, and I mean, it usually needs 10 to 14 days of rest. Well, I'm at the point where I feel so good that to take 10 or 14 days off of exercise, it's not happening. I love to exercise. I love to play my pickleball or run or work out. And so if I don't have that, well, I'm not a very happy camper. I don't use it as much, but I still have a lot of my male patients that think that it's the best mechanism for them, and so it works wonderful. But for my female patients, it is a very quick onset, and the results are life-changing.
For someone right now listening, or that may get maybe one of these clips sent to them or come across it on their feed, what advice would you give to someone who's noticed some of these symptoms or signs that you've discussed of weight gain or mood swings and changes, or losing hair, or any of these other things that we've discussed today? What advice would you give them to maybe look into hormone therapy, or what advice might you give them to begin down this path or this journey?
I think the most important is education. If they're nervous or scared or they've heard, I hope they'll listen to these podcasts, because we're going to teach you all that you need to know so that you will help you get over your fear. My experience is fear stops people from doing good or bad, right? And so we want to get rid of the fear so they can make a sound decision to move forward. The other thing is, reach out. We have patients asking us questions all the time. On our TikTok or our Instagram, please reach out. Call the office. If you have questions, we can give them the exact blood work to get that they can take to their doctor and get the right blood tests. We find that most doctors, when they order the blood test, they don't even order the right stuff. And so they'll come in, well, I've already had my blood work done. Well, yeah, but it doesn't tell us what we need to know. And so it's very important to get the right stuff, the right information, because then once you have the right information, then you can make the right decision and make the right treatment plans so we can get them to feel better.
So for anybody who'd like to find us after hearing this content, where would they be able to go and find you?
Well, we'll be on YouTube, TikTok, Instagram, but there'll be a link on here that will link everything together. But come in, if you want to learn how to feel better, have more energy, if you want to feel like you did when you were young, follow us and watch these podcasts, because we'll teach you.
Can you guarantee we'll look like you?
It will take time.
Okay.
But with time, we can get you looking this good, all right?
Hey, Doc, for somebody, desperate today, is it an option for them to see you? Do you practice currently?
I am currently practicing, and it would be an honor to help you. Once I found out that I can feel better, and I've helped so many people, we'd love to have you come in, and we'd love to get you started on your own pathway back to your optimal health.
And they could send us a message on any of our Instagram.
Oh yeah, reach out and
TikTok.
I've got
or
an
get on the
amazing
website.
team that will connect with you and get you in the right direction. If you have questions, reach out to my team. They'll help you out.
What do we have to look forward to next week in our episode?
I'm excited. We're going to break down testosterone for men and women.